Hello everyone, my name is Divya Shah and this is my reflection on our project, master's project. Our topic for our master's project is insights on diabetes and use of ML, machine learning to predict onset of type 2 diabetes. My role in the project as a team manager, researcher, and data analyst. Assigned tasks was project management, managing team, organizing documents, especially the review and literature because of my expertise in medical field, evaluating appropriateness of work and project development. What are the future tasks of what we are going to accomplish in each and every sprint, whether whether it was achieved or accomplished appropriately, whether we meet the targets or for each sprint, and also monitor the progress of project, whether we are on time, we are not lagging behind, we have achieved all the pre-decided milestones for each and every sprint. So for me, especially for sprint, I have got a different milestones to be achieved during different sprint one. This is the evidence for our project roadmap. Yeah. So project timetable for sprint one, I was expected to complete the collection of articles, at least 10 to 15 articles on the prevalence of diabetes, and also implementation of machine learning for predicting type 2 diabetes. I analyzed those articles based on their relevance to our study and justify and select the one which are relevant to us, relevant to our study. Then we also collected data set which has attributes which are actually a real time risk factor for type 2 diabetes, and which has less bias and more balanced. And mostly we focused on the fact that whether we can apply on a general population or not. So it's secondly, for project timetable in sprint 2, I was expected to to develop a KNN model based on the data set, and for that, one of our team members did the cleaning, and I applied that one for developing KNN model. And we did plotted a few of we plotted all the graphs regarding the attributes and their relation to diabetes. So basically here attributes are risk factors and how they are affecting the prevalence or incidence of type 2 diabetes in a given individual. So thirdly, in sprint 3, we actually had we had results from all the predictive models, and I have done the analysis based on various factors such as accuracy, F1 score, and all. And I also compared based on the research whether the traditional one is better than hybrid model, and we analyzed all the results statistically. So that is an important one. And then this is the evidence for our user story and acceptance, which are acceptance criteria, which I worked uh, during the time before deciding like a storyboard, user roadmaps, and all those things. So I decided and discussed with the client what are the acceptance criteria we are after for each and every user board. So we make sure that we meet the scopes of the of scope. We meet the demands or needs of our client. So that is our ultimate scope to which we would like to achieve during the project. So that was very important um, in order to do that. Secondly, I have done this is the evidence of contribution for a literature review. I performed this task during my sprint 1. So a few of the interesting research paper I collected, like how different risk factors which we used as attributes, especially BMI, um, BMI, age, sex, weight, height, systemic blood pressure. But interestingly, they also have mentioned a positive family history, but there were very less data set with that attribute. So this played a very vital role to understand what are the physical risk factors which are involved for type 2, and what are the the genetic one. So this was very important to see the relationship between all these three factors and diabetes. So secondly, there was a paper from Naz and Ahuja, and they discussed how machine learning or predictive models can be used as a prognosis tool by the doctors or healthcare professionals to detect the disease, and how deadliest the disease can be, and early prevention uh, by usage of machine learning by all the doctors and healthcare professional can treat the disease or prevent it from going to deadly conditions. So thirdly, there was a study from Zhang. He conducted that study during 2017, and from there we actually developed. They actually developed a two groups case and controls. For cases, they used machine learning and predicted the diabetes, and for controls, they didn't use the machine learning or any liberal learning techniques, and they saw the incidence of type 2 diabetes in both the case and controls, and also they compared the relation with gene pool, so which was very important for us. Thirdly, this is evidence of my data set description and the attributes and their relationship with the diabetes incidence. So we plotted all these graphs by using our data set, and we saw the relevance of each and every data set with the diabetes. So interestingly, all our risk factors are related to diabetes, and they pretty much have the same results and the cutoff point for each and every risk factors in order to decide whether the patient is a pre-diabetic uh, or a non-diabetic or diabetic. So this was a very important factor, because then we can decide whether our data set is relevant to general population or not. Then KNN was like Canon, this is evidence for our Canon predictive model, and but I was the one who worked on this one, and it was very important. After completing the plotting of all the data set, I um, I tried to relate it with the general population and the facts of how all the attributes are related to diabetes, and whether they are they have the same results when we compare it with our data set. Then I applied that data set for developing KNN predictive model. It's one of the easiest, one of the simple predictive model, and it works on supervised learning, and it used the one function called Euclidean distance, and where they decide the observer, the new test observer, by their pre-decided k neighbors. So if the more it is near to one of the neighbor, that's how we classify them into diabetic and non-diabetic, or into two cluster group. Here it is diabetic and non-diabetic, they are two cluster group. And the best parameter for us was k is equal to 5, because we have to calculate KNN until multiple folds, like until I did for k is equal to 11. Then but the best accuracy I got for k is equal to 5. And the accuracy I got it for overall accuracy was 0.88, but when it comes to KNN is equal to 5, I got the accuracy for KNN as 0.90. This plays a vital role when I compared the results between the various predictive models. So this is that evidence for various results which we received. I received from various predictive models and then compared it. So there are 4 or 5 factors which I compared it. Which I compared the predictive, where I compared the predictive models such as accuracy, precision, recall, F1 score. Interestingly, all these parameters such as accuracy, precision, recall, and F1 score are point basis. They are not something which we can generally apply over the data set and any given observation. But however, the ROC AOC gives you a generalized range of their accuracy. So when it comes to this factor, KNN perform is one of the most skilled predictive model, whereas SBC is skilled if we compare uh, um, it it with other predictive model based on the parameter called as accuracy. So this factor is very important because we have to see whether how accurate is the predictive model, but at the same time how they are performing over the period of time where we have different observation. Why this is important? Because we I got accuracy for one of the parameter with the help of KNN. But when we compare the same threshold for different, by default we choose zero point 0.5 and develop the confusion matrix. Then at that point, SVC performs very well. So their performance is not a static; it's actually dynamic. It's changing according to the different observation and confusion matrix. Here the most important thing what we have to think is what are the parameter we have to take the most important, like we are basically focusing on positive, so that is true positive and false positive for us. Therefore specificity becomes one of the most important parameter, because that actually classifies and predicts the disease. For us it's a prediction of type 2 diabetes, so mainly we have to focus how specific is the predictive model. So that's all for comparison of the results. I also compared our data set with other data sets such as Prima Indian, which was basically more focused on females because it was counting number of pregnancy and other attributes or which are considered as risk factors, which cannot be relevant to a general population. So in that case, our data set is having attributes and risk factors which are relevant to a general population. Personal learning, I did the negotiation and communication skill. I learned these skills um, very very efficiently. I also learned how to work in a team. There were times where it was difficult, but then all those communication skills and negotiation skills helped me to go through those difficult and easy times as well. And I learned how to officially document the research um, and make it evaluated or with according to our client. Secondly, I also learned how to do a proper literature review, where I have to justify whether that paper is relevant to my project or research or not. Secondly, I learned visualization and their comparison with the real thing, so that real world data, so that we can apply our project into general population on mass scale for mass screening of type 2 diabetes. And statistical analysis was very important in order to decide whether one particular project or is feasible, or have a document which can be implemented for a general population. Suggestion for this course is project guidelines. We do have a common guideline for software and by business analysis. We got different criterias. Uh, we should have different criterias for both these studies, because there are points where we cannot present and to show the data or show our work, because our work was mostly on descriptive study. um, that it was much easier for the software students to showcase their work, but it was very boring and the procedure was not appropriate, was not made for business analysis student or descriptive or research students. So I really wish the criteria are different. And similarly, the marking criteria, when you have to do the research, it's very hard for them to give each and every time a video on sprints and all. So it's different. It should be the marking or guideline criteria should be different for business analysis and software students. Yeah. And third, the most important thing, team member distribution. We shouldn't be having the choice to choose our own team member, because then we don't know how to work in a real time scenario where we can't choose our workmates or professional colleagues, and we are exposed, we are more exposed to the diversity and dynamic work situation. So that's all. And thank you.